Changes are coming to how Northerners with HIV are treated by the law if they don't tell their partners their status before sex. Canada's Attorney General has new rules. One of them, people with low, extremely low counts of the virus won't be prosecuted. Katie Toth has more on what this means for us in the North.
Criminal cases related to not disclosing one's HIV status are pretty rare in the North, but there has been one high-profile offender. In 2013, Bobby Kautiluk was sentenced in Yellowknife for 2 counts of aggravated sexual assault. He had sex with 2 women and didn't tell them he's HIV positive. But the GNWT says, for the most part, the spread of HIV isn't a big problem in the territory. Fewer than 35 residents here have HIV.
I think most patients with HIV today can be maintained in a state where their viral load is undetectable, and so the risk of spread is really nil. And even in the past, the great majority of patients with HIV wanted to do the right thing. They wanted to make sure that their partners were protected and they wouldn't be spreading it unknowingly to other people.
In Nunavut, the health department didn't give us any numbers on its HIV rate, citing patient privacy. In Yukon, the government says there were 7 newly reported cases of HIV from 2010 to 2014. One health expert says governments in the North should be ready.
We're just waiting for a possible epidemic in the North with HIV because there's other issues around, for example, high rates of chlamydia and gonorrhea in the North. So those actually biologically make you more susceptible to acquiring HIV if you're exposed. And then there's smaller circles that smaller social networks smaller sexual networks in the North. So once the virus comes to the North, if there's already a high prevalence of STBBIs, then there's a likelihood that there could be an epidemic.
Logie says decriminalizing not disclosing HIV will help prevent that epidemic from happening by making people more open about their status and more likely to get tested sooner. One Yukon advocate agrees.
There's testing available in remote communities, but many people are reluctant. We've heard in our work that people are reluctant to get tested in a remote community because they worry about anonymity and confidentiality. Not that necessarily it has been broken, but they have concerns.
Bacon is hopeful the decriminalization will make people less ashamed. The new changes come into effect tomorrow. Katie Toth, CBC News, Yellowknife.